Everyone. Hello, hello. We are going to be presenting on care coordination, the importance of care coordination for students and the campus community as a whole. My name is Brenda Lapinid. I am a licensed clinical social worker. I work at the University of California, Irvine as a campus social worker. Previously to coming to UC Irvine, I was in medical social work as well as psychiatric social work.
Good morning, everybody. My name is Sheena Danesh. I'm also a licensed clinical social worker, a campus social worker at UC Irvine. I've been at UC Irvine for the past 7 months. Prior to that, I worked a few years in a nonprofit mental health agency contracted with LA County Mental Health. And I've also worked with the Department of Children and Family Services. We wanted to get a feel of who's in the room today. Raise of hands, who's a representative of a community college? Great. How about Cal State? Fantastic. And UC? Wonderful. Any private universities? Fantastic. Great. Well, welcome everybody. Thank you for coming today. Day 2. Thank you.
Okay, so what we all hope that you will walk away from this program session is to one, be able to identify some on and off-campus departments that you will be able to collaborate with and hopefully effectively serve at-risk students. And then secondly, we would hope that you would be able to identify some benefits of care coordination as well as devise strategies of care coordination relevant to your own campuses. So taking a look at UC Irvine at a glance, just so you're familiar with the area where we're coming from and the campus that we serve. We're one of 10 universities in the UC system, and we're located in South Orange County, about 15 minutes away from Disneyland, about 10 minutes away from the beach. It's a pretty affluent area. We're a 4-year public institution, and we have close to 30,000 students. Just some other information about UC Irvine. We are one of the fastest growing UCs. We've had an increase of about 10% in the number of applicants from the previous year. We also have 58% of our incoming freshmen are the first in their families to come to college.
Another interesting fact about UC Irvine is we are the second largest employer in Orange County, second to Disneyland. Our student population is close to 30,000, and as you can see, the majority of our students are undergraduate students. Our workforce, not including, we also have a UC Irvine Medical Center located in Orange, but our workforce, excluding the medical center, is 10,000 employees. We have approximately 12,000 students who reside on campus, and we have a growing number of international students. We have approximately 2,000 this year.
Okay, so we will be sharing a video of a survivor story, a survivor of Virginia Tech. As a trigger warning, if at any time you feel uncomfortable, please feel free to step out of the room. She is going to be going into some graphic detail.
We heard the first shots at around 9:40 a.m. I was sitting on the wall of the classroom, so in the hallway, and I could hear the shots getting closer and closer very quickly. I mean, there was only a few seconds between the first time we heard them and when he actually walked in. To me, it sounded like an axe being taken to a piece of wood. And our teacher, she opened the door, and she peered outside, and she immediately shut the door, and she said, "Call 911." And right then, he walked in just seconds after. There's absolutely no time to think or to duck or to take cover, and people just kind of fell to the floor. And he immediately walked in shooting, and he went to the other side of the classroom, and he started going down the rows. He went down each row very quickly, very purposefully. And I remember thinking, your turn is coming. You're going to get shot. I mean, I didn't realize there was an active shooter, but I knew something bad was happening. He came back to our classroom 3 times, and on the 3rd time, he killed himself in the front of the class. In between each time he was there, you could just hear people crying and coughing, and the cell phone started ringing. When he was in our class, I remember trying not to breathe very much, so he couldn't tell I was alive. because as my stomach was hitting the chair, I was thinking, you know, he can see me breathing, he can see me alive, and that was very scary. I'll never forget when the SWAT team first broke in at around 9:51. The officer in the front of the classroom said, "We have a lot of blacks in here." And at the time, I couldn't comprehend what he was talking about, but he meant triage codes. And I remember looking to the girl to my right and realizing, you know, what black meant. He looked over me and he said, first he said yellow, and then he changed it immediately and he said red. And that's when I first started panicking. I still couldn't speak. I was shot 3 times, lying on my back. And I remember thinking, what do you see? Like, what can you see on me that I can't, that you would change me from yellow to red? He killed 12 people in my classroom, including our teacher. Your perspective on life and your attitude and your relationships definitely changes after you experience something like this. I noticed very quickly after the shooting, just my outlook on things, my behaviors, my attitudes, what I valued really shifted and has changed dramatically. You're much more grateful for small things in life. You look at people differently. You appreciate traffic a little bit more because at the end of the day, you get to be there. You get to experience traffic. You get to feel, you know, the frustration of being alive, and that's something that we can never forget to not take for granted.
Okay, so we share this video with you for 2 reasons. One is Christina might be somebody that a case manager on a higher ed campus would reach out to, right? If she were to come back to campus, we would want to check in with her. We would want to make sure she has the services in place to assure that there's a good transition back to campus and that she's going to be successful. The other reason that we share this video is that higher ed case management really began after the Virginia Tech shooting. So there's been a culture shift on a lot of campuses to hire higher ed case managers in order to fill this gap in services. The first actually identified case manager was from the University of Miami in 2000, and that was a split position. So it was a full-time worker, one worker, in the Dean of Students office and in the counseling center. And then the demand actually grew for that, and they separated the positions into 2 full-time positions in 2006. Now, case managers are found in different departments on campus, and I'm sure all of the UCs are aware of this, right? They can be in the Dean of Students office, they can be in the counseling centers, they can be in Res Life. And then as part of the behavioral intervention teams, many case managers sit on these teams because behavioral intervention teams themselves are somewhat of a case management process, right? Administrators are coming together, they're trying to figure out some pretty creative and flexible solutions in order to identify and assess and respond to risk on campuses. And then lastly, we want to emphasize that case management in higher education settings is really to provide outreach, engagement, and prevention to our students. So a lot of the times our offices will get calls from a faculty member or a staff member concerned about a student because they're starting to show a decline in their functioning, right, in their normal functioning. So maybe their grades are going down, maybe they're not looking the same as they once used to, maybe they're unkempt. And the role of our office really is to outreach to the student and say, hey, you know, a lot of people on campus are concerned about you, what's going on? At UC Irvine, we use the term least intrusive levels, starting at the least intrusive level. And it really means outreaching to the student earlier on so that we can get to them before the needs compound and become more complex.
The standards of case management that we follow are the following. We address our students as a whole individual. We view them as their own experts on their own life experience. Each student has their own unique narrative, and we do what's called a biopsychosocial assessment. So when a student is referred to us, our services are voluntary, so they do have the right to accept or decline services. Once they accept, we do the assessment, and from there, it's a constant collaboration, not only with on-campus and off-campus partners, but we're in constant collaboration with the students that we work with and helping empower them to access services on and off campus. We also approach it as a client-centered decision-making process. So again, from the beginning, from that first initial contact, we want them to be involved in their plan. Because studies have shown, and we all know, if we're involved in a plan and decision-making process, we're more likely to follow through on it. Another guiding force is decreased fragmentation of care, and we'll go into that further, decreasing silos and increased communications across campus and within the community. We practice evidence-based practices. We practice motivational interviewing techniques, solution-focused, and also strength-based perspective. So we build upon our clients' strengths, resiliency, their protective factors, while also assessing their risk factors and their needs. And we pay careful attention in using change language along the way, in driving them, in empowering them to reach their goals. We help assist clients in moving them to their optimal levels of health and well-being by enhancing their problem-solving skills and their coping capacities. Consistently, we're always assessing risk factors, suicidal ideations, homicidal ideations, child abuse, elder abuse. And lastly, our goal is to improve care plan adherence. And so our goal is for our clients to reach their goals. And if we need to make modifications along the way, if the goals aren't attainable, we want to make sure that the goals are measurable. We'll help assist and tweak along the way to support our students.
So Sheena and I, our office, the social work office, is actually housed within the Wellness, Health, and Counseling Services cluster. I won't read the whole mission statement, but at the very bottom there you see our units are committed to a holistic orientation to service delivery, which involves impacting not only students, but the entire UCI campus community and academic climate. So we really are taking the student and this holistic perspective, not only in addressing the student, but in working with the student and meeting their needs. Other departments in our cluster include our Student Health Center, our Counseling Center, our Disability Services Center, our Health Education Office, our Campus Assault Resources and Education Center, as well as our Campus Recreation. So we're a pretty big cluster. So as I said, Sheena and I are housed in the office of the Assistant Vice Chancellor for Wellness, Health, and Counseling Services. We're also fortunate enough that we've recently hired a part-time social worker case manager in our counseling center.
The population that we serve is predominantly students, predominantly undergraduate students. However, we also work with a small caseload of faculty and staff, and we also work with what we call affiliates. So affiliates could be spouses of students, children of students, also it could be alumni or people that are frequenting our campus, and it may be causing some concern or some need. The services that we provide, once a student or individual is referred to our office, we outreach immediately to them. We provide an assessment if they do agree to services. We involve them in the planning process, and we are constantly coordinating care with our on-campus partners, off-campus partners, with our students' family if they give us permission to do so and if it would be in their best interest. We also provide advocacy within our campus departments. We write letters of support as needed, and we're constantly monitoring the process to make sure that they're meeting their goals or they're working towards meeting their goals.
Any questions so far about our process or our model?
Where does the funding for that part of your services that supports faculty and staff come from?
It comes from our boss. No, I'm just kidding. It's well, our positions were funded through Prop 63, and there's actually not a separate pool of money for us to work with faculty or staff. But our roles are going to be changing in that there is going to be what they call a mental health coordinator. So it's a PhD level person who is going to be working with faculty and staff. So, you know, the very small population that we work with will probably be going down to zero in the next couple of years.
And that mental health coordinator will be housed in the HR department.
So here's a list of some of the on-campus partners and student affairs that we work with. We really couldn't do our job without the partnership and the collaboration with these folks. I mean, you know, students come to us because there is a need, and typically it's not us that's going to be able to provide them with the answers. We do a lot of consultation with the departments listed here. So I'm just going to go over some of the examples of how we work with these different departments and how we work in collaboration to meet student needs. So for instance, with our housing, they're a big referral source for us, and we also advocate on behalf of students in order to obtain emergency housing. So if we have a student who's been in a situation where maybe there's domestic violence or there may be some safety concerns, we really try to push and advocate to get that student into a safe environment on campus. Financial aid, so how many of you are case managers or have a case manager on your campus? So how many of you have seen an uptake in financial need? So same with our offices as well. So a lot of students come to us because they don't know where to get the money from, right? How are they going to pay for school? How are they going to pay for housing? We really try to explore options with the students and come up with some creative ways. And a lot of the times we do consultation with our financial aid office, talking to either the director or the associate director to see what other options are there. So that might mean emergency loans, budget adjustments. We also have a student affairs emergency fund that's run through our vice chancellor's office. So anytime a student is in a dire situation and there's a health or safety concern, a committee will review an application and we will provide a grant to a student as needed. Some of the things that we have funded students for are medical transportation, medical copays, prescription copays, those kind of needs. How many of you have seen an uptake in food insecurity or the need for food on campuses? Same with our office as well. So we work very closely with our hospitality and dining services in order to provide emergency food vouchers for our students. We don't have a food pantry on campus. We are working on one, but we do provide emergency meal cards to students if it's appropriate. We partner with our counseling center very much. A lot of the times, students are either transitioning out of care or no longer eligible for services. So maybe a student who's withdrawn or going to be suspended or dismissed, they may refer the student over to our office so that we can plug the student into some off-campus resources. The same thing goes with our student health center. We have psychiatry services there. They do not have a designated case manager or social worker, so they do refer a lot of students over to our office if there's additional needs. And then finally, the Campus Assault Resources and Education Center. It's our sexual assault office, and they provide advocacy to victims. But a lot of the times what we're seeing now is that there are two students involved with either a DV situation, stalking, sexual assault, and we want to be able to make sure that we're responding to both students. So the care office will outreach to the victim, and then our office will reach out to the alleged perpetrator. And then there's a whole bunch of other ones. I won't go into them, but you can see them there.
Some additional on-campus partners that we work very closely with are our academic counselors and our deans. We partner with them when a student is experiencing various stressors. It could be housing stressors, mental health, physical, variety of different things. And if there's extenuating circumstances, we will go ahead and advocate on the student's behalf. We work very closely with the counselors if the student maybe needs an extension in test-taking time if it's appropriate, may need a reduction in caseload depending on what's going on. We will support the student and advocate, but also partner with the academic counselors. And we work closely with them in providing them education about our services, the benefits of the things that we can do in order for them to help their students. So they identify students, they'll contact us, and we partner together in supporting our student population. We also work very closely with our Title IX coordinator. They'll refer students and situations over our way if the individual is in need of emergency housing, which could be on or off campus. If their need is academic advocacy, we'll be there to support. Whatever their need is, we will work in collaboration with the Title IX coordinator and the individual that's referred. And we consistently consult. We have the behavioral intervention team, which Brenda will talk about, and then we also have a CART team that focuses on stalking, sexual harassment, and domestic violence. We also work very closely with our UCI Police Department, specifically in situations when a student is voluntarily or involuntarily hospitalized. They will notify our office once a student is hospitalized, and then we'll do immediate outreach. We'll collaborate with the hospital social worker. We'll outreach to the student, help them with reintroduction back onto campus, or help them take a leave of absence or withdrawal if that would be in their best interest. They also do weapons checks for us, specifically when we're talking about students of concern that are in our, that we're discussing in the behavioral intervention team. So they'll do weapons checks. They'll also inform us of students who have restraining orders. And in rare circumstances, we'll also go out when a student is incarcerated or they're in jail or prison. We'll go out if that situation is of great concern for the university campus. We'll go out and meet with that individual, provide them with services. Maybe they need to take a leave of absence, so we'll help guide them through that process. Some committees that we sit on, you can see the list of committees. All of the committees have multidisciplinary partners on the team. And we meet on a monthly basis. We talk about the trends on campus and off campus. And I think it's really important because we hear from our partners who are in multidisciplines. We get to talk about our services, what's working, what's not, how can we strengthen our partnerships. And we also talk about the national trends and international trends. And as Brenda had mentioned, the Student Affairs Emergency Fund and the LGBT Resource Emergency Fund are two committees that we sit on in emergency situations when there's a health or safety concern and a student would benefit from emergency funding, one-time funding. The committee will convene and review the student's situation and provide them with funding if it's appropriate. And a new subcommittee that UC President Janet Napolitano had devised. It was the UC-wide Student Food Pantry and Access Subcommittee, which is also part of the Food Initiative Project.
Okay, I'm just going to briefly go over our behavioral intervention team. So you can see from the diagram here, we have core members in the middle who attend our meetings on a weekly basis. These guys are always at the meetings every week. And then we've got activated members on the outside of the diagram, and those people are invited on an as-needed basis. So maybe they've observed the individual's concerning behavior, or maybe they're the ones who are reporting it to the consultation team. So we will invite them as needed. On the bottom, the diagram shows what our team activation looks like. Prior to 2012, we were meeting on an as-needed basis, but that was really time inefficient. We were meeting 2 to 3 times a week, sometimes 4 times a week, and so we just decided to have the Monday standing meetings. It was just easier for everybody's calendars and schedules. And then we also meet on a semi-annual basis or quarterly basis just to talk about what's going on around campus and what are some of the emergency and crisis intervention protocols. So we're fortunate in that our UC Irvine has a medical center. We've got a hospital that we work with, and we do outreach to students who have been hospitalized. The police gives us their police reports for any 5150s, involuntary hospitalizations, and so we have a memorandum of understanding with UCI Medical Center. In order to keep this relationship going, we meet with them on an annual basis. So we meet with the attending psychiatrists, we meet with the unit social workers, as well as representatives from our counseling center and our student health center. The unit social workers will call us. They will actually call us if they have a UCI student who has been hospitalized. And the way that they view it is, and I know a lot of hospitals don't do this, but the way they view it is that it is continuity of care planning. And we may have information that it would be imperative to their treatment planning. So they feel, it's better to err on the side of, giving information so that we can all collaboratively work together to get the student transitioned back to the campus successfully.
Some of the off-campus partners, however, this list is very extensive, but these are the most common ones that we work with. We work with University Town Center, which is right across the street, pretty frequently. We have a good working relationship with them. They'll email us when they have discounts on, monthly rent, and we also work with them if there are some housing issues that we can help mitigate and work with them and the student. We also partner with mental health providers and agencies off campus. Our goal is to have a yearly meet and greet, and so we're looking to do one in the fall where we invite all our campus community partners on campus, and this is just a way for us to strengthen our relationships, for them to get to know our campus culture, and for us to get to know them and their specialties and who would be a best referral for a certain situation. Second Harvest we're really proud about is a new partnership that we have this year. As I saw a lot of raised hands earlier, the need for food insecurity issues. We are seeing a steady increase in the need for food, and so we've partnered with Second Harvest. They have a CalFresh enrollment specialist that will come out onto our campus, will sit with the student, pull up the laptop, the CalFresh application, and go through the application with the student. So far it's been pretty successful in the number of enrollments that students have gotten. We also partner with Community Service Programs, which is a advocacy victim survivor support agency. We have a part-time individual that resides on campus part-time, and then we also work with the victim advocates that are placed in our local police stations. They are an integral role in helping the students fill out the California Victims Assistance Program application if they are a victim or survivor of domestic violence. And they also walk the student through the court process and advocate on their behalf if needed and if the student chooses to take that service. We also partner with NAMI, National Alliance on Mental Illness in Orange County. It's been a great resource, especially if clients' families are interested in receiving services. They have the family-to-family programs that we're able to link them to. And Share Our Shelves is a great agency. They are a one-stop shop. They do employment assistance, social service assistance, financial assistance, legal aid, tax assistance, medical, dental, pharmaceutical, and so we'll refer a lot of our students there as well. But the thing we want to highlight is, and the name of the conference is Stronger Together. So we really want to stress that we couldn't do this without our on-campus partners, off-campus partners, our other schools in California and abroad. We are working the same goal with our students, and so we are stronger together, and our students are stronger together when we partner.
So we'd like to say that case management is perfect, but it's not at this point. We do face a lot of challenges and barriers. One is there are too many cooks in the kitchen sometimes. So I think as student affairs professionals, we're always trying to advocate on behalf of our students. And sometimes a student could be working with multiple student affairs professionals. And so I think it can be very confusing for the student. It can cause a duplication of services. And really it goes against what we hope to be something as time efficient. It's going against that. It's too much time dedicated to one student when one person could do the job. The other piece is silos and fragmentation. So somebody in a presentation yesterday mentioned that because there can be a lack of resources within our institutions, people tend to hold on to information, not intentionally, but not intentionally, not with malice, but that's just kind of the culture, right? And so we'd hope that in order to be effective in providing care to our students, we kind of break down those silos and talk to one another. The fourth bullet point, disagreement among multidisciplines, we put that on there more for the behavioral intervention teams because we've got so many different disciplines sitting on these teams, and whenever we're trying to come up with a coordinated plan, not everyone is in agreement. I think that as far as UC Irvine's consultation team goes, we've learned to be respectful of one another's opinions, but it's not always very easy. And then the next two bullet points, changes to resources and demands cannot meet needs, we put that on there more so for the off-campus agencies because there can be economic restraints and funding issues. We are not always able to provide the appropriate off-campus services to our students just because there may be none or there may be limited resources available. And then systemic barriers to access services. We do mental health therapy referrals for off-campus providers, but transportation, just something as simple as transportation, can be a big issue for our students, especially our international students who don't drive. We have a lot of students who aren't willing to take the bus for an hour and a half to get to a therapy appointment. They'd rather just not go. And then lack of social support for client. Our population is a very big Asian American student population, and there is stigma in getting help. And so we find that students sometimes are hesitant or decline to meet with us because their families think that it's okay to just keep it within the family and that the issues can be resolved within the family. So that's another barrier that we face. Time consumption. So case management doesn't take 5 minutes or 10 minutes. You can work on one student case for a whole day or 2 days or 3 days. We also have frequent flyers, so those who come into our office very regularly. I have one student who I've been case managing for 3 years, and hopefully I'm going to get her graduated soon and successfully. And then finally, the last 2 points, meeting the client where he or she is at. So we always try to respect the client's self-determination. We can't force our services on a student. All we can say is, there's an office here available for you on campus if you might need assistance. We're hoping that we're at least putting a bug in their ear if they do decline services, and that maybe they'll utilize us somewhere down the line. Oh, and then privacy. We do utilize releases of information even within our campus community. We follow our professional code of ethics through the National Association of Social Workers. And so it is always a balancing act for us for trying to give enough information, but not too much information in order to advocate on behalf of the student.
So in honor of National Suicide Prevention Month and coordination of care and services, we wanted to show you another video. His name is Kurt, and he's going to tell his story.
My name is Kurt, and 2 weeks ago I completed my undergraduate degree, and in 3 days I'll be starting grad school. I really enjoy just hanging out with friends, and I read a lot for school and outside of school, and I do a lot of volunteering. I'd moved here and trying to meet some friends, so met some people here in the community, and one weekend we were at a friend's apartment just hanging out, having a good time, being, typical summer college students. And some of us are outside hanging out and talking about college and our semesters and getting started. And a friend of a friend who I didn't know very well started saying, I don't see myself having a future. I don't see myself living very long. I cannot see myself having a profession or a job or a family. It was really an odd statement for us, and we began to ask him, questions about where this was all coming from. We thought, is there something that, we should know? Are you sick? Is there something that you haven't told me? It began to dawn on us that it might be that he was thinking about taking his life. With that in mind, I asked him and I said, have you thought about suicide? And he didn't say yes and he didn't say no. And that stood out to me. Well, we had to decide for ourselves what action we wanted to take. And we knew we weren't prepared to help him, but we knew a social worker who would be. And so we said, we need to call her. And that was a little scary because, this is late at night, it's the weekend, and we're gonna be really taking her, on her personal time. But at the same time, we had his life to consider, and we said, nothing outweighed the value of his life. Nothing was more valuable than that. So we said, we're making the call. So while we stayed talking to our friend, one of my friends made the phone call to the social worker, told her what was going on, and said, this is what's happening. And she said, put him on the phone. She walked him through the situation. She got him connected with supportive services, and we stayed with him that night, and we didn't leave him alone. And after that, he got connected to those supportive services. Some of the pressures that he was facing was related to his sexual orientation. He was gay, and he had experienced bullying in high school, and reached out and got certain social supports, and he was about to lose them and move on to another part of his life without those social supports. So that was a really crucial time for him, and I wasn't even aware of that. And most of us, as far as I know, weren't aware of that. But we heard the signs, we saw the signs, we made the call for help, and we referred him, and he's alive today. And I see him around and, touch base with him from time to time, and he's doing well and pursuing his dreams and really becoming an amazing individual.
So I just wanted to highlight Kurt and his friends. They were very astute. They were very hypervigilant, but they followed their gut and they reached out for help and support. And I think there's other sessions that are going on during the conference talking about suicide prevention, educational programs, and I think all the work that each one of you do is so important. It's planting those seeds. It's educating our student, staff, faculty population on what's out there and how we can prevent certain situations and sometimes dire situations. Even though it was scary for Kurt and his friends to reach out, they did a wonderful thing. His friend was able to get those supportive services in place. I think it's also important to pay attention to the timing right now. So there's a lot of, the semester is starting, quarters are starting, and on the way here, yesterday, I heard on NPR that this time period is referred to the red zone from now until November, Thanksgiving time. And so it's important for us to be aware, students are transitioning from high school, they're transitioning from community college or out of state, out of the country, and so this is a really important time for us to be aware of those factors and help support the students in providing prevention and early intervention. Benefits of care coordination, which leads into the prevention and early intervention piece. It is so important. If we're able to work with a student earlier on, we're able to decrease the needs in the future, complex stressors and everything, if we get those supports in place. Another benefit is reduced symptoms, retention in treatment, reduced hospital use, improve overall well-being, family relationships, peer relationships, academics, increased level of functioning, and student retention. But not only student retention, also success in the future, joining the workforce and employment.
So we intentionally had 2 slides of benefits of coordination of care as opposed to the 1 slide of challenges and barriers, because we want to just highlight how important it is on each of the campuses to have somebody who's managing these type of students. So I'm not going to go over all of this just for the sake of time, but one of the things I did want to highlight was a duty of reasonable care on behalf of the different institutions. So sometimes people say, well, why hire a higher ed case manager? What's the point? It's more of a liability. Well, what's liability if you don't have somebody outreach to the student, right? And so it just shows that somebody is outreaching to the student, there's clear documentation, referrals have been made, and communication throughout the campus has hopefully been put in place. And then one of the other things too is that we try to destigmatize the process, not just in getting mental health care, but destigmatize the process of reaching out to get help and assistance.
And then how to, different steps in order to reach that coordination of care and support for our students. So outreach and marketing to our partners, we're consistently doing that, building and nurturing, strengthening those relationships. We also have a feedback loop in place, so we always make sure to respond back to the referral source if the student agrees for us to do so, and in most cases they do. Also for us to be dependable and follow through with what we're going to say. So if we say we're going to reach out to the student within a week to do follow-up, we want to make sure that we do that. We also want to make sure that we do that with our on and off campus partners as well.
And then valuing partnership and expertise. So we are not experts in, really the different departments. We really rely on contacting them and having that consultation. If there's a certain policy that we don't know about, we have the different relationships in place to contact our point people. And then as far as the team effort, that's a big thing, because sometimes we'll have students come to us saying, well, so-and-so told me this, or, this department told me that. And I really think it is beneficial to the student as well as to the entire campus community that we're all delivering the same message to the student, so that one, they know what their expectations are from us and what to expect in the process down the line. And that's it. Sorry, we might have gone over time.